Chapter 15, Nervous System. In the next section of the nervous system, we're going to look at the definition, pronunciation, and spelling of diagnostic terms and complementary terms. In this section, we're also going to look at the definition, pronunciation, and spelling of behavioral health terms, the abbreviations that relate to this system, and we're going to apply it in some clinical notation contexts. We'll look at some diagnostic terms, and the first term we have is cerebral angiography, and this is a process of recording cerebral blood vessels. And CT myelography, this is the process of recording the spinal cord along with the use of a contrast or a dye is a part of that as well. Electroencephalogram is record of the electrical activity of the heart. You see this not infrequently used on patients with seizure disorder. Evoked potential studies, or EP studies, it's a group of tests to measure the changes and responses in the brain. And lumbar puncture is a diagnostic procedure where they place a needle into the subarachnoid space and remove some spinal fluid, and this is done, again, it's a test that's not done maybe every day, but it is a test that's done fairly frequently as a part of diagnostic evaluation. Looking at some examples of complementary terms, and these are built from word parts, we have aphasia. This is a condition where someone has no speech. Dysesthesia, this is a condition where there's difficulty of speaking. Hemiparesis is paralysis of half of the body, and usually that's one side or the other, and we see this sometimes as a result of a stroke or a cardiovascular accident. And then neurologist is our next term. This is a physician who studies and treats diseases and disorders of the nervous system. And post-ictal is a situation or timing that occurs after a seizure or an attack. Now let's look at some of those terms that are not built from word parts. Ataxia means lack of muscle coordination. Cognitive means it's a mental process where you're looking at comprehension, you're looking at judgment, memory, and reason. Incoherent means unable to express one's thoughts or to process in an orderly manner or in an intellectual manner. Shunt is a tube that's placed in to direct the flow of fluid, and this is a lot of times patients who have head injuries, especially head surgeries or masses, or have had surgery or those kind of things in the brain. A lot of times they will put in a shunt in order to direct the pathway of the spinal fluid during or after that process. Syncope is fainting or sudden loss of consciousness, and typically this is because they have a reduced amount of blood supply to the cerebrum temporarily. Some behavioral terms. A psychiatrist is a physician who studies and treats disease and disorders of the mind. Psychogenic is originating in the mind. Psychosis is a little more complicated. It's an abnormal condition of the mind, often with some degree of derangement, delusions, or hallucinations, and this is quite often one of the more difficult diseases and more evolved diseases of the mind. Behavioral terms include autism, which is defined as a spectrum of mental disorders. Generally, it starts early, in infancy or early childhood, and the spectrum refers to a multiple of variations of this type of disorder. So there's different phases, stages, and all are different types. But they'll have often a preoccupation with subjective mental activity, have difficulty interacting socially, and also sometimes some difficulty in communication. Bipolar disorder is a major psychological disorder. We refer to this disorder as a disturbance in mood. They go through two phases. They'll go through a manic phase, which is a more irritated, excessive, impulsive phase, and then they'll go through a depressive phase where they are depressed essentially, and all the signs and symptoms of that. It can go from one to the other, it can alternate, or it can have signs of both, or they may be predominantly more in one than in the other phase of them. The next one is obsessive compulsive disorder. This is quite often referred to loosely as OCD, and it's a common abbreviation. It's in this case, they will have intrusive, unwanted thoughts, and the result of that is they want to repeat the same act over and over, or same ritual over and over. And it's basically with the intention of trying to release tension or anxiety. And one of the ones that's sometimes mentioned here is a hand washing compulsion, or someone who repeatedly washes their hands even though they don't necessarily need to, and that would be a repetitive act in that case. Post-traumatic stress disorder, it is a significant disorder, and quite often is because someone has been exposed to a traumatic event of some kind, and so they develop multiple symptoms in most cases, and it varies from one, to the degree at which they may have symptoms or signs. They typically may do things like they will kind of reinvent this event in their mind. They may go into a fight or flight effect or response more frequently. They may also just choose to try to avoid thoughts or activities that remind them of whatever the trauma or event was. They may withdraw, and they quite often will have difficulty in making emotional contact with family or being close to family and friends. Schizophrenia is a significant mental health disorder where it really is more a group of disorders than one simple disorder. They will have a lot of times distortion of reality. They'll have maybe language disturbance, communication difficulties, may withdraw, may have disorganized thoughts. They may have fragmented thoughts or perceptions. And they may have emotional reactions. And there's, again, varying degrees of this to less involved to more extreme type of schizophrenia. There's several abbreviations in this system, but some of the most common that you'll see are AD, which means Alzheimer's disease. EEG is electroencephalogram, and this is a test that's very quite often used for patients who have seizure disorder. LP is lumbar puncture. PD is Parkinson's disease. And TIA is transient ischemic attack. And if you have trouble remembering this, think of the first word there is transient, and when we talk about a person being transient, it's a person that moves from place to place and doesn't stay there a long period of time. So in a transient ischemic attack, this event comes and then it goes, and once it goes, there's no evidence of it after that. So the analogy fits pretty well. In this section, we're going to read basically a short medical report, and this using some of the terminologies of the chapter. And if you read it along, it may help you in the pronunciation of the terms, but it also helps you to understand how the terms are used in actual context in healthcare. A 36-year-old right-handed female presents to the emergency department for an episode of monoparesis of the right leg, which started earlier in the day. She has a history of major depression, for which she sees a psychiatrist and is treated with medication. About 6 months ago, she had an episode of optic neuritis, which is inflammation of a nerve, which was treated with steroids. She denies any history of seizures. On examination, she noted to have gait difficulties, and this is how you walk, basically, due to the weakness of her right leg. There was no evidence of paresia or paralysis or cognitive impairment. Because of her age, a diagnosis of stroke or TIA is unlikely. A subdural hematoma, which is basically a blood clot in the subdural space, or intracranial lesion such as a meningioma or glioblastoma, must be ruled out. Her symptoms are suggestive of multiple sclerosis. We will order an MRI of the brain and with contrast to see if any characteristic lesions are present. If not, we will consider a lumbar puncture and refer her to a neurologist for evoked potential studies.